another episode of today's live sessions with the fertility specialist. It's good to have you back. It's good to be back here. If this is your first time on the show, we want to say a big welcome to you. We are promising you that it's going to be an informative session today. Stay glued to your screen, glued to your TV, or wherever you're watching us from today. If you are a returning viewer, you are the real MVP. We're sending you a big shout out and a warm hug from here. My name is Abimaje Iliojo Grace, and I'm your anchor for today. With me live in the studio is an amazing personality, Dr. Kenneth Eguda, the very popular, the very dogged, the very dedicated, hardworking,
Really?
enthusiastic
Good
Dr.
to hear
Kenneth.
that, man.
Dr. Kenneth, you look very good. You have a very lovely necklace on.
Oh, yeah, my African necklace.
Yes.
Thanks so much.
Welcome, sir. So today we're talking about fertility and cancer treatments. Does cancer affect fertility? Does it affect reproductive health? Is there a way forward after cancer? Can I have children after having cancer? Possibly ovarian cancer, uterine cancer, breast cancer. Can I still have children? And what is in there for me? What's the future? What lies in the future for me after having cancer? You're welcome, Dr. Kenneth.
Thanks, Grace.
So we have a series of questions that we'll be asking you, sir, and we hope that your answers will allay the anxieties in our hearts. We hope that your answers would provide solutions to the challenges or to the problems that we're facing with cancer. So we'll start with the first question. How does cancer and its treatments like chemotherapy, surgery, radiation, and the likes, how does it affect fertility in both men and women? What are the effects of these treatments on fertility?
That's a very big question,
Yes, sir.
In the first place, I would like to sympathize with all of those who probably have been diagnosed with some form of cancer,
Yes, sir.
and a bigger sympathy is for those who are undergoing treatment,
Yeah.
and also want to identify with those who have undergone treatment
Treatments.
successfully and have
Yes, sir.
survived it. And I wish them the best in the future. Okay, cancer actually has been on the rise,
Yeah, lately.
lately, and all around us, surrounded with tertiary institutions. Okay, and there's no limit to the kind of clients that tertiary institutions
Let's
see.
see.
And one way or the other, we share clients with the tertiary institutions.
Institutions.
And what intrigued me so much, it's the age at which some cancers are picked up in people today. I could remember a young girl at the age of 22 with breast cancer.
Hmm.
Very interesting,
Very
and that's
interesting.
that's very bad. And watching the last female World Cup, the information is everywhere. One of the most valuable player in the last female World Cup just finished, underwent successfully a
Cancer
treatment
treatment.
for cancer of the ovary.
Hmm.
And then she was in her 20s, cancer of the ovary at the age of 20,
That's pretty young.
pretty young. And it's amazing how she went through the treatment and
And
came
still,
back to
yeah,
football and was one of the
most valuable.
MVP
Yeah.
in the female World Cup. Shout out to her. And
Shout out to you wherever you are.
we're rooting we're rooting
We
for
hope you are
her.
watching our video.
Yes, we're rooting for her. So that's how rampant or prevalent
Yeah,
cancer
cancer is
is. Maybe in some other time we'll talk about why cancer is so prevalent
prevalent.
these days. But it's just all about the lifestyle and the environment we find ourselves today contributed so much
Much.
to the prevalence of cancer. So back to your question,
Yes, sir.
how the treatment affects them. In the first place, let me talk about how cancer itself
No,
affects them.
fertility.
Fertility. Now, it depends on the kind of cancer,
Yeah.
and the location of the cancer. But I guess since we're talking about reproduction,
Production.
we may look at are directly organs involved in reproduction. And the organs involved in reproduction are the pituitary gland. Pituitary gland is in the brain, somewhere in the brain. Then you have the breasts and the ovaries, the uterus, the cervix, the testicles in a man, maybe the penis itself. These are organs of reproductions, and then cancer could affect any of those. But then there are areas where cancers affect, that are not necessarily organs of reproduction, but their treatments affect organs of reproduction. When you get to this area now, you have to think about little kids that are affected by cancer, all kinds of cancer in
Yeah,
children,
true.
you know, the Burkitt's lymphomas with medications used for children. These are childhood cancers, and all other kind of cancer. And if you watch television, often you see a whole lot of children having cancer
Cancer,
treatment with
yeah.
no hairs, looking bald and all of that. These are effect of a cancer treatment, so cancer itself, because of the high metabolic condition associated with cancer, reduces the chance of an individual getting pregnant
Pregnant
and sustaining
pregnancy.
pregnancy. And then the pregnancy itself can affect the cancer negatively and makes the person or individual deteriorate so fast, depending on the location of the cancer and all of that. So cancer on its own affects
Pregnancy.
pregnancy, affect the health. You have to be healthy before you get pregnant.
True.
So if you get pregnant with cancer,
Cancer.
with or without medication, your health condition is going to deteriorate likely so fast, and a good number of these conditions will not be compatible with pregnancy, because cancer is just what it is. To a large extent, we're getting good cure for cancer these days, and some improvement in life expectancy after a cure for cancer. But pregnancy is a heavy metabolic load, and then it makes management of cancer or tolerance to cancer a little bit difficult.
Difficult.
So it just affects pregnancy negatively. It affects pregnancy negatively, and some of the cancer sometimes may warrant the pregnancy process to be terminated,
Terminated.
so that treatment can commence quickly, and so that the individual can also tolerate the cancer process, the cancer as a condition easily without pregnancy. So it makes the prospect of carrying pregnancy very difficult, you know. And most times, reproductive obstetricians or gynecologists would prefer not to deal with you with your deal with pregnancy with the cancer, as against having you been pregnant and going through the cancer process. But now the medication itself, the treatment, affect a whole lot of the organs involved in reproduction. One of the ways to treat cancer is to do radical surgery,
Yeah.
especially in this part of the world. Radical surgery. For instance, if a woman has cancer of the ovaries, one of the ways, depending on the stage of the cancer, in this part of the world, you want to do a total clearance of anything that is close to the organ that has been affected by the cancer. So if your woman has cancer of the
The
ovary, for
ovaries.
instance, I remember when we're doing the core gynecological practice, you want to do total removal of the uterus and the ovaries and the fallopian tubes. In which case, you have rendered this woman
Sterile.
sterile. After that, you could want to do some if it's a cancer that has not spread so badly, you want to do some form of hormone therapy so that she can cope with the effect of being medically menopausal. So you clear all of those. So when you do this kind of intervention, for instance, there is no prospect of pregnancy, except of course you want to do pregnancy by advanced assisted reproduction technology. When a woman's uterus is removed, pregnancy is only now possible by surrogacy. You know, I don't know. We may be talking about uterine transplants,
Transplant. Yeah.
because yes, the world has recorded some pregnancy following uterine transplant.
Mhm.
Yeah. So it's a prospect that the world is looking at. Then, if it's the ovaries, for instance, that is totally removed, she can get pregnant, but now with
Donor eggs.
donor eggs. Occasionally, the treatment may just be be chemotherapy.
Mm.
Now, the chemotherapy itself, or sometimes it could be surgery followed by chemotherapy, or sometimes chemotherapy followed
Followed
by
by
surgery.
surgery.
So, if it's chemotherapy, for instance, you know the side effect of chemotherapy:
Yeah.
total loss of hairs, injuries to the surfaces
Mm.
of the body, the tongue, the intestines. You have diarrhea,
Mm.
loss of, I mean, the blood itself gets affected because the medication for cancer doesn't necessarily discriminate between
The
the
cancer
cancer and
cells.
other cells.
Mm.
So it just goes wrecking all the cells, and especially the fast growing cells,
Mm.
in which case the tongue has a fast growing, the
Mm.
intestines have fast growing cells, so they just get wrecked. So you have consistent diarrhea, blood
Mm.
loss, injuries to the mouth, surface of the tongue, and all of that.
Mm.
And the same thing happened to the ovaries now. The drugs affect the ovaries,
Mm.
and then it makes the ovary lose its egg stores, so that either the egg stores are totally lost,
Mm.
or they become significantly lost. So no matter how young a woman is now, she may be battling some condition with, I mean, fertility prospect with
Mm.
less eggs or poor quality of eggs. The same thing goes with the man.
Mm.
If he's getting some form of treatment, it may also affect the sperms producing cells and the sperms themselves. It
Mm.
could render the man reduce
Mm.
fertility potential or total loss of fertility potential. So
Mm.
that's how cancer treatment affects whoever is affected by cancer.
Thank you so much, sir, for those answers. My mind just kept wandering around when you're answering. This is so educative, sir. What are the recommended fertility preservation options for men and women? You said something about how these medications could damage the sex organs,
The reproductive
the
organs, I mean.
the reproductive organs, basically. So my question is, say a person has cancer,
Mhm.
and like a young person, a 22-year-old is battling ovarian cancer, and she desires to have children. Is there a recommended fertility preservation option for her or for a man? Is there something that can be done to salvage the situation? Say the person has to go through chemotherapy
Mhm.
or a radical removal of the organ entirely. Is there something that can be done to preserve her own sex? It's like she wants to have children on her own
Mhm.
and not with somebody else's eggs or things like
Okay,
that,
so I
sir.
think maybe I would suggest that we take your question in parts
Okay,
and
sir.
parts.
Yes,
Let's
sir.
deal with the female.
Yes,
Then,
sir.
if we have enough time, we'll talk about the
The
males.
male.
Okay, so
Yes,
that
sir.
way I also have it at the back of my mind. We're talking about these different sexes differently.
Yes,
So let's
sir.
look at the woman, for instance. Let's assume you have a woman with cancer of a reproductive organ.
Organ. Yes, sir.
Now, the reproductive organ could be the cervix,
Mm.
the uterus itself,
The
the
ovaries,
ovaries, or even the
fallopian
fallopian
tube.
tube.
Mm.
Now, it depends on where
This
these
cancer is found.
cancers are.
Mm.
So if it is the let's say fallopian tubes,
Mm.
and then it's proven that it hasn't gotten to the ovaries,
Mm.
and then you have to treat. Now, theory has it, or rather, the current finding is that even cancer of the ovaries take their origin from the fallopian tubes.
Mm.
So it's a very difficult situation.
Situation.
Okay, so you look at the cancer, the area that has been affected.
Mm.
After due evaluation and investigation,
Mm.
you determine what kind of treatment this individual
Needs.
needs.
Mm. Yes, sir.
So, if an ovary has not been affected, for instance,
Yes, sir.
you could just remove the ovary that has been affected together with the
Mm.
fallopian tubes. That way, you are leaving the woman with one ovaries. You could also take part of the ovaries, yes, and preserve them. I mean, you cut part of the ovary that has not been affected by cancer
Mm.
and preserve them just for the future.
What do you mean by preserve, sir? How do you do that?
You literally cut part of the ovary that is healthy
Mm.
and cryopreserve it. You preserve
Okay.
it. You let me use the word freeze it. You can dice it in pieces
Mm.
and freeze them, and then the woman can utilize them later after
In the
her
future.
cure, depending
Mm.
on the kind of treatment.
Mm.
Because you see, the cancer may be affecting just one part of the ovary or the fallopian tube. Human has two ovaries and
Okay.
two fallopian tubes. Once you've proven that it's only one arm that is affected, it
Mm.
means another arm is healthy. So you can take advantage of that, take part of the healthy ones and freeze them,
Mm.
and then you can use them later,
Later.
depending on whatever usage you want to put them into.
Mm.
Now, another thing that could be done is, if it's possible to stimulate the woman, for instance,
Mm.
you grow her eggs, to take her eggs, because the prospect of freezing eggs is a lot better
And
than
freezing the
freezing the
ovaries.
ovary itself. Because when you take the ovaries, you freeze, you preserve the ovaries for the future. The usage later requires surgery
Mm.
and putting back the ovaries. I mean, transplanting the
Yes.
ovaries to the broad ligaments, for
Mm.
instance, and giving them opportunity to take. So you do whatever is feasible and available in that circumstance with the technology available for that individual.
Mm.
Then you have preserved part of her fertility. So this requires that all oncological clinicians, for instance,
Mm.
cancer clinicians, should always discuss with their patients the prospect of reproduction.
Mm.
More so if the patient has not had families or
Mm.
haven't given birth to children. So that can be done. If it's a breast, for instance, and you're going to do chemotherapy, it's
Mm.
good, though the breast is far from the ovaries and all of that. But the hormones produced by the ovaries affect the breast.
Mm.
So you want to think of what to do to this woman. You give her the treatment that the breast cancer requires.
Quiet.
If it requires taking out the breast,
Mm.
you take out the breast. But of course, after taking out the breast, you require chemotherapy. Now the chemotherapy doesn't spare the ovaries.
Yeah.
You're treating the breast, but it's
Completely.
damaging the ovaries.
Mm.
So in this case, you could treat the woman to get her eggs.
Mm.
You could also take part of the ovaries to preserve, because cancer treatment takes a lot of toll on the woman's reproduction. You know, so these are the things that could be done. While you're treating the breast cancer, you're trying to preserve her.
Mm.
Of course, when she's when reproduction is very important to this individual. So a real conference meeting should be done, even if this individual is a child. I mean, a young that requires parental consent. You have to do, because this treatment would have a far-reaching effect in the future.
Mm.
So you have to always think of reproduction. Yeah. So, well, it depends on the kind of cancer and what needs to be done. But then every tissue or organ of reproduction can be protected. If it's radiotherapy, for instance, you want to do,
Mm.
there are sometimes you do radiotherapy for
Radiotherapy.
some aspect of the body, but you shield
The other
your
aspect.
the organs of reproduction,
Mm.
from the effect of
That is
radiotherapy, because the same way that chemotherapy affects the
affects
organs of reproduction is the way that radiotherapy
affect.
affects it.
Mm.
So you could shield organs. Sometimes you may even have to do some kind of surgeries. For
Mm.
instance, you want to irradiate the uterus or the pelvic. You may want to do some kind of procedure to move the ovaries out of the line of irradiation
Mm.
so that they are spared. So, but failure to do any of those means you're just radically treating this cancer and causing collateral damage to organs that will be needed for function
In the future.
now and the future. Because you see, you could finish all this treatment, even if you don't need reproduction, you could render the woman menopausal.
Mm.
You can imagine having a young girl at the age of 20, 30
20.
already menopausal because of cancer treatment.
Dealing with hot flushes and the
So
likes.
these are some challenges with cancer treatment. So
Mhm.
this is the female aspect. Sometimes it could be cancer of the brain, of the pituitary.
Mm.
You go affect the pituitary,
Mm.
but pituitary controls the ovaries.
True, sir.
So you have to have a good discussion between the oncologist, the reproductive scientist,
Mm.
the client, and her parents,
Yeah.
if it's a minor, so that decision on how to preserve the eggs or to preserve the ovaries and a future reproduction is going to be considered. The same goes for the man.
So, sir, our next question is, how do these preservation methods work in practice? And what are the storage and retrieval processes? So, how do they really work? What's the expectation? What do we expect from these processes?
Okay. Um, Now, I'm glad, there was some time not too long ago, I had a good number of patients from a teaching hospital around us
Okay.
who were diagnosed with some genital cancers,
Hmm.
and they were going for chemotherapy. And I was so surprised that several of them were sent to Alps hospitals
Hmm.
for fertility preservation. I began to wonder what was really going on. You know, a day you could see three couples coming that they've been
Hmm.
booked for this
For
procedure at this time, and then they were
the
asked to come
advice.
and talk about fertility preservation. But at the point they were coming, the date of the cancer treatment commencement has been fixed already,
Hmm.
and then you have no time to talk, to prepare, and to do the tissue or cell retrieval for
Hmm.
preservation. But it's good that the knowledge is beginning to be rampant.
Hmm.
So, for instance, if a man has some form of cancer, it doesn't matter wherever the cancer is. It could be laryngeal cancer,
Hmm.
it could be cancer of the brain, it could be cancer of the tongue, cancer anywhere, but the medication affects. So, in this case, for the man,
Yes,
he could produce his sperms before the cancer treatment,
hmm.
and the sperms can be stored. Production of sperms is it's can be in different forms. You can have intercourse and have a withdrawal. You could have a
Hmm.
masturbation, get the sperms, you know. So those are the ways to you could use a vibrator or a machine to make him produce sperms, and
Hmm.
then you store the sperms. And these sperms can be stored for a very long
Long
time,
time.
for years, and can be used later based on the written document on what should guarantee his use, for him to achieve uh, fertility concerns. You know, that's basically for the man.
Hmm.
The prospect of harvesting the testicles and keeping doesn't come in here. It will be too far an intervention to offer. But if he has sperms, you could retrieve the sperms and freeze the sperms. As for the lady, for instance, depending on the kind of cancer and whether or not the cancer are sensitive to hormones,
Hmm.
you now determine what kind of treatment you're going
To
to do. There are
do.
some cancers, for instance, that are sensitive to estrogen, to progesterone, and all of that. So you have to know what kind of cancers are the receptors of the cancer, the kind of cancer, the location of the cancer, before you determine what kind of intervention to give her. But if the cancers are not sensitive to the hormones of reproduction, for instance, you could stimulate the woman. Control ovarian stimulation, retrieve the
Hmm.
eggs, just like you're doing an IVF treatment
Yes,
cycle,
sir.
and bank the eggs.
Hmm.
For a young woman, for instance, egg retrieval, you could get up to 20,
No,
15
wow.
to 20,
Hmm.
and once you get up to 15 to 20 eggs, that helps guarantees reproduction in the future, or rather gives her some prospect for reproduction in the
Reproduction.
future. And if it is such that her hormones of reproduction will affect the kind of cancer she has, cancer doesn't stop a woman from ovulating. So you could do a natural cycle process of IVF,
Hmm.
retrieve her eggs,
Yes.
but you're going to get few eggs, of course, and then you bank the eggs. If she's already married, but then pregnancy will affect the cancer, you could get the eggs
Hmm.
by the process of IVF, by whichever means it's safer
Safe.
for her and the sperms of her partner, and make the babies and freeze the babies. Then you could use the baby. You could decide to get someone pregnant or have pregnant when everything is all right. I
Yes,
prefer
sir.
this one actually. Generate the embryos, which is the
Hmm.
potential babies, and cryopreserve. You know, so those are the things. Of course, taking chunk of the ovary and preserving it for future use. It's
Hmm.
what is trending in the European society right now as we speak. Not many facilities do it, but that's the best to do. That's the best to do. If you have the technicalities and the facility to do
To do
that,
it.
it's like you're doing an organ preservation.
Mm.
Because for me, one thing I wonder is that I know that nature is very wasteful. A woman has several eggs,
Eggs.
but later when she wants to make demands on the eggs,
They
we
are
tell
nowhere
her
to
the
be
eggs
found.
are finished.
Mm.
So we could actually preserve that. So
Preserve.
those are some of the ways to go about preserving it. So irrespective of where the cancer is located, we need to have a conference discussion with the oncologists, the gynecologists,
Just.
the client, or even the parent if it's a minor.
And even their spouse if they are married.
Exactly, even their
Mm.
spouse if they're married. So that way you plan. Even at the end of the day, you are not able to carry pregnancy by yourself. That's an option of
Turn
doing
to
surrogacy,
surrogacy.
and somebody bears the pregnancy for you.
Mm.
So that's the way to go about it. So cancer doesn't necessarily mean you cannot have kids. Of course, you can get cured of cancer, get remission of your cancer, and if the oncologist and the uh, gynecologist feels you can still be pregnant, then of course
Mm.
you make attempt at
Mm.
getting pregnant.
Yes, sir.
That's the way it goes.
Mm.
So retrieving it, preserving it depends on the kind of cancer,
Mm.
where the cancer is located, the kind of treatment that is feasible,
Mm.
and whether or not most cancer treatment actually affect
Yeah.
reproduction.
Mm.
That's just it. But what bothers me most is prospect of children with cancer.
Mm.
You can imagine you have a kid having a chemotherapy, and at the end of the chemotherapy,
And then
the reproductive
reproductive organs
organs
are
get
gone.
compromised. You know, you're waiting for a future that you don't even understand. So that's the way to go about some of them. So you retrieve them. Everything is individually dependent.
Thank you very much for your answers, sir. So I want to speak to the viewers. Um, Dr. Ken has spoken about some of the methods of preservation. We do most of these things at House Hospital. Please visit our facility today, and you would not regret it. Our next question: what are some of the emotional challenges faced by cancer patients dealing with potential infertility, and how can they be addressed? Like what are the issues, the emotional challenges basically. I don't even know how to put it, sir.
I'm also trying to understand your question.
The emotional challenges, the society has it that when you are married the
Mhm,
expectation is that you should have children.
mhm,
It's almost like the moment you get married, people begin to look at your stomach as a
mhm,
woman, your abdomen. Is it growing? Are you growing fatter? And they are not saying are you growing fatter because you're enjoying. The
mhm,
expectation is that you should be pregnant. And a lot of people are put under pressure to want to succumb to societal expectations, and they know what they are dealing with. So
mhm,
it's like there's this emotional embargo that is placed on them. How do they handle this? How do we tell society that you don't need to pressure women into doing these things, because people are going through a lot of things? And
mhm. So it's a very difficult one.
yes, sir.
You know, the society deals with a lot. And the society doesn't even accept a lot. The prospect of even doing ordinary cesarean section is not acceptable
Acceptable by
by
some people.
a cohort of people in the society. They malign you and criticize you. They also stigmatize you. And now you have cancer. Nobody cares to
Mm.
know whether you have cancer,
Or not.
painfully enough. And then they want to make demands on you to get pregnant. For me, I don't think pregnancy is a matter of life and death.
Mm.
And I really don't care who gets bothered whether I'm pregnant or
Or
not.
not.
It is life first.
Mm.
If you've been diagnosed with cancer, for instance, I don't think you should bother about what people think about you.
Mm.
If it's a society that is sane, everybody should sympathize with you, support you, encourage you, because the diagnosis of cancer on its own is like a death sentence.
Mm.
And for some people, it is not the cancer that kills them,
Yes, the
it is the
thoughts. Yes,
psychology
sir.
that they are living with this condition that kills them. And we have a good number of people who have been supported and have beaten cancer because they have the right mindset and they are living
Healthy
as good as
lives.
possible. So I won't say anybody should allow himself to be troubled by the society. If the society cares so much, society should support you. What we should do to people having cancer is to stand by them, encourage them, and fertility should be the second thing they are thinking about.
Mm.
Yeah, that's what my thought would be, because you shouldn't get pregnant just to
Mm.
satisfy other
Other
people.
people.
You should get pregnant for yourself, and society should play low when it gets to that
Mm.
aspect. And be close to your gynecologist and oncologist and take advices from them as much as possible.
Possible.
And of course, if you have been cleared that you could get pregnant, because there are some categories of cancer of the cervix that you could get pregnant after treatment,
Mm.
especially if the treatment is just a physical treatment. I mean, surgical treatment without chemotherapy. Even with chemotherapy, and you've been cleared, you could make
Mm.
attempt at fertility care based on what you are advised. So shouldn't allow the burden of the society to weigh us down,
Mm.
but those with such diagnosis should get support from us, and then encouraged to carry on with their lives, because I think at that point pregnancy is the next, it's not the first thing
The
you're
list,
thinking
yes, sir. The
about.
list of the issues. Thank you very much, sir. Our next question is: how long should individuals wait after treatment before trying to conceive, and what factors influence this decision?
The same thing. Usually cancer treatment has stages,
Mm.
and we have the remission, the cure, and all of that. So it's not a duration that I can just pick right here, because it takes different time duration for
Depending
different
on.
individual to
Mm.
achieve a state of remission and even cure of
Mm.
cancer. Okay, so this decision is going to be taken by whoever is taking care of them, the oncologist, the gynecologist, and the reproductive gynecologist. You know, but at the end of the day, it is only when a woman is certified free and
That she
healthy
can.
by a managing physician that she
Mm.
should make the decision to getting pregnant.
Mm.
And if it is a difficult decision to make, for me, I like playing safe. If it's possible, get someone to carry the pregnancy for you and stay healthy for yourself and for the babies that comes through you.
Mm.
You know, so surrogacy is a very good option when cancer diagnosis is made.
Mm.
So that just it. So it all depends on what conditions is acceptable to this individual and her spouse, or his spouse.
Mm. Yes, sir. So next, he talked about surrogacy. We could help you out with that at House Hospital. We do almost everything at House Hospital as regards fertility and all of that. Our next question: what are the chances of successful pregnancies after cancer treatment, and what are the potential risks during pregnancy?
I think for me, this is the most important question you've just asked today.
We saved the best for last.
This is the most important question you just asked. You see, when you have cancer treatment, whether by not physical treatment now, by physical treatment, I mean when you do surgery. Surgery is a physical treatment, okay?
Mm.
You do like cryo therapy is also a
Okay.
physical treatment, you know. So, but you have chemotherapy and radiotherapy. This treatment goes further than what anybody else is see.
Mm.
Chemotherapy, for instance, and radiotherapy increase the degeneration of even the leftover reproductive
Organs.
cells, so that
Mm.
even when the woman has potential to get
Pregnant.
pregnant, or the man's sperms has potential to make a baby, to make babies, they are not as high quality as they should have been if there were no cancer treatments.
Mm.
That's to say, for instance, a woman who has undergone cancer treatment has reduced fertility potential, more especially if it's radiotherapy
No
or
chemotherapy.
chemotherapy that is used, because they have a negative effect
Effect.
on the organs of reproduction. So it can increase the rate of DNA fragmentation
Mm.
for sperms, even for the woman, could increase the level of oxidative stress, which doesn't only damage the reproductive organ but even other health cells in the body.
Body.
All of these reduce the ovarian reserve and
Mm.
affect the count, the morphology, and health of sperm. So
Sperms.
after cancer treatment, the reproductive potential reduces,
Reduces.
and that is why the emphasis is on fertility preservation
Vision.
before cancer treatment.
Treatment
So you could
commences.
just finish cancer treatment as you're still young and you find it very difficult to achieve pregnancy. Doesn't mean you don't have eggs, but the numbers are reduced. It doesn't mean you don't have eggs, but the quality of the eggs. And for women, for instance, the ovarian apoptosis index, which is a show of the health of the eggs and how damaged the eggs are, is always higher after cancer treatment. And so this makes prospects of pregnancy and carrying of
Pregnancy
pregnancy
difficult.
very reduced. So the emphasis is always on fertility preservation. Yes. And that is why when I see the whole barrage of people who have been diagnosed plunging into the clinic, I was like, yeah, some level of awareness in the environment. And so it means something positive is happening. So it just means we should expand the scope of care for these categories of people and create rooms for fertility preservation for the society. Even though I'm aware that population is not very important in this part of the world.
Do you have any specific recommendations for monitoring fertility health after cancer treatment, especially for people who are trying to manage their finances and things like that? Let's say I'm an average person
Mhm,
who does not really have so
mhm.
much and I'm diagnosed with cancer and I still want to have children in the future. What advices would you give to me? How do you think I should go about it? Because we hear a lot of time that fertility treatments are quite expensive and all of that.
So you mean how to monitor them?
Well, yes, like monitoring health and monitoring their health and their fertility health rather,
Mhm.
monitoring the fertility health and what they can do to preserve. Are there cheaper options that exist for preservation of
There are no cheaper options. All the things I just mentioned are very
expensive?
pricey options. They're quite expensive. You know, yes, they are not the best modality of of fertility care because they are they're expensive. And then you need very advanced facilities to undertake such. And as I said, that the government of the day may not be very interested
They're
in this
not
kind
put
of thing
in
because if
place.
for anything we are too populous and we have not harnessed the impact of a population like us, even though we have been projected to be one of the most for the future to be one of the most economic viable population. I mean, in the next 10 to 20 years, you know. But what needs to be done in case of them trying to know what the fertility prospects are is to check with a reproductive gynecologist who really understands what health of reproductive organs are. For instance, if you've done some form of treatment for cancer, whether chemotherapy or radiotherapy for some form of cancer, for a man, for instance, it's okay to check what your sperms looks like. And now this is just a very crude way of analyzing it. And what do you check? The count of the sperms. Usually, it's better to check what the sperms are first before the
Before
treatment starts, and then you check what it
they are
is
after.
after the treatment. And then what you check now, you may want to check what the DNA fragmentation is, because you see, a man can have 20 million sperms, which is very difficult actually to find in this day and age. 20 million sperms, but then he has high level of DNA fragmentation. DNA is located in the head of the sperms. And when they have high level of DNA
Then
fragmentation, which is what
fragmentation.
cancer treatment will cause, you know, then it means the prospect of having kids is
Is low.
lowered. You know, for the woman, for instance, you could do there are parameters to check the reproductive hormones, the FSH, LH. Now, in this part of the world, FSH and LH it's commonly checked. But FSH and LH are not real indicative of the ovarian reserve because they are not very reliable. A woman may have gone out of good ovarian reserve and FSH and LH is still
So
showing normal. So the anti-Mullerian hormones advisable. Inhibin A, inhibin B are more predictive than antral follicle counts. These are things that could be checked. And of course, if you have a course to retrieve eggs, you could see whether the eggs are fine, but of course, or not. So those are the things that should be checked. You know, I like what happens in England, for instance. They have a routine way of checking whether girls are going to be reproductively viable for a very long time. And so nothing stops a cancer program having indices like these to check whether male or females are going to be reproductively viable,
Viable.
and the length of time they could stay reproductively viable after such kind of treatment. So you can advise them on how soon they should get pregnant or get themselves pregnant or have kids by some means. Okay, so there's just a lot that still can be done with respect to cancer and monitoring their reproduction. Of course, what's more important than reproduction is even their health and their and their comfort after the cancer treatment. A good number of people, like women, for instance, may become menopausal quickly after cancer treatment. After cancer treatment, depending on the type of treatment given, anyways. So those are the things that I think that can be done. Well, even the general population should make effort to check what their reproductive potentials are. It's against just only cancer people checking.
Thank you, Dr. Ken, for this educative and informative session. Do you have any final words for our viewers?
Yes, I think while we're talking about cancer, my final words would be: let's make a lot of effort to screen for cancer, for instance, because the the public health awareness is more important than allowing yourself get into all of these things. And then our daily life practices have made cancer
More
very
prevalent.
a lot more prevalent than they were in
Those
days gone by or years gone by.
Mm.
For instance, a lot of perfumeries, deodorants, and all of these things that we apply on our body just for comfort may be incriminated for a lot of all of these cancers. The current rise in cancer of the breast, for instance, you wonder why it's cancer selecting the breast. Now, almost every woman rubs something on the armpit. Almost every woman does that. Recently I was in England and I was just happy I was in England. I was not in Nigeria. And then I make sure I didn't apply any cream on my body. I can be crazy sometimes. I make sure I didn't apply because yes, I wasn't sweating, but good. Or already now there is a temperature crisis all across Europe, and I'm glad I'm in Africa. I left there 2 days ago, and the temperature crisis started. So I'm saying that we should be selective
The things
of
we
the
use.
things we use. Now, some of these deodorants that we either roll or spray have a lot of chemicals that are plastic related. Some of them are heavy metals. And you know that the lymph nodes are in the armpits. I remember when we were in the medical school, when the clinical examination, we always check armpits, whether there are lymph nodes. Lymph nodes are the police, immune police of the body. You have lymph nodes everywhere in the body, and when the work is to trap bad conditions, disease conditions. You have in the groin, you have the clavicle, you have behind the ears, you have just around everywhere. If you check the lymph node, you see they've trapped a lot of things. And just a matter of time, metastasis will happen, things will change, and cancer starts. Some of them are mercury, some of them are aluminium. You can imagine ingesting all of these things into the body. So this is one of the major reasons why there is high level of cancer. So women, ladies, and guys should check, and then the creams we apply, the makeups we do, we should tend towards the more natural constituents than the artificial or metallic constituents. We should eat healthy, then we should screen frequently. Men over 40, PSA,
Mm.
prostate examination, advisable. Women 35 and above, or in fact, I would say women at 20 should do regular breast examinations, so that early detection would help save the day for a lot of us.
Mm.
So we should eat healthy, we should live healthy, and avoid chemicals as much as possible. These chemicals don't only cause cancers, they cause reduced fertility, they cause diabetes, they cause thyroid abnormalities, they cause all kinds of abnormalities, endocrine disruptor factors and all of those. They cause mutations in
Mm.
our DNA, and the disease that was never in your genome can find himself in your genome because of abnormalities following consumption of unhealthy materials. Consumption doesn't necessarily mean you drink
Drink
it.
or
Anything
eat.
you apply on your skin,
Skin.
the skin absorbs everything
Mm.
faster than the mouth
Anything.
or the intestine sometimes. So anything you apply goes into your system.
Mm.
And that is why things are happening the way they are.
Mm.
So that's my final word, if that is a word at all.
Thank you, Dr. Ken. Dr. Ken said we should eat healthy, live healthy, and avoid chemicals. Thank you for staying this far with us. It's always lovely, it's always beautiful to have you here. You are the real MVPs. Bye for now.
Thank you.